Well, good afternoon. Thank you. Like I said, I'm Jim McHugh. I'm the County Veterans Services Officer. Retired Navy, 26 years in the Navy, naval aviator. Who are my veterans here? We got veterans? Outstanding, outstanding. Like I said, in the Navy for 26 years. I kind of joined the family business. My father was in the Navy for 30 years. My sister was in the Navy for 20 years. They were both lawyers, so I told them I'd join the real Navy. It's a great experience. My last job here was I was the commanding officer of Naval Base Ventura County. So that was a great experience, great time, and great working with this wonderful community we have here in Ventura County, which I think is, and I've been throughout the country and the world, I think is one of the best supporters of the military and veterans that I've ever experienced. So thank you all for being part of that community. As I said, I'm the County Veterans Service Officer. I've been in this position for about 3 years. And just to give you a quick little overview of our office, we're located in the River Park building, which is near the collection. You're familiar with the collection shopping center there in Oxnard. We are right there. It's 2901. And I have flyers up here that you can grab at when we're done that has the information, the address on there. But it's 2901 North Ventura Road. We're up on the 3rd floor of the River Park building. And I also have field offices throughout the county that are open certain days of the week. And again, in the handout has a flyer on that. We've got one at the Gold Coast Veterans Foundation here in Camarillo. That's on Wednesdays. That's a walk-in facility. Also on Wednesdays, I have up in Simi Valley at the Americans Job Career Center there on Madeira. That one is a walk-in facility also. Then on Thursdays in Thousand Oaks, I have a person at Supervisor Gorell's office. That one's a by appointment. He's there from 9 to 4. And then every other Wednesday is at the Simi, actually one Wednesday a month at the Simi Senior Center, and also one Thursday a month at the TO Senior Center. All that information is on the flyer there, but just to let you know where we reach out also to outside just our offices in Oxnard. So what is the purpose of a Veteran Service Office? We are here to help veterans, surviving spouses, dependents, file, understand, learn, and track their VA and state benefits. Now, and at no cost to you at all. There are organizations out there that you have to pay for. And I would rather you go and try to do this stuff on your own than pay someone to do that for you. Because many of these organizations aren't accredited. We are accredited, meaning we're accredited by the VA. We have been trained by the VA. We are able to go into the VA system, look at the records, track the claims, file claims for veterans. But many of these other organizations aren't. And the way to tell that is that they'll say, hey, I'll help you fill out the claim, but then they give it to you to submit. Or they want your credentials to go online for you and submit that stuff. Do not do that. If you don't remember anything today, remember, don't pay anyone to fill out a VA form for you, okay? Because these benefits are earned by the veteran. You don't need to be giving it to someone when there's a service provided for you to do it at no cost. And my office, I've got I got about eight claims officers, give or take. I've got a few openings there, but we're all accredited, as I said. So we can go in there and really help you out with those kind of claims. Also, we can refer you to different other organizations or different benefits that are available to you. We've got the brand new VA healthcare clinic in Ventura, 50,000 square foot facility, beautiful facility, a lot larger and better than the one that used to be in Oxnard, I think off of Rose. I'll be upfront with you, they have had challenges on hiring, in doctor hiring, and as anyone who's ever tried to get a government job, you go through USA Jobs, it's almost an act of Congress to get through that thing. It takes a long time for that process to happen. They have I think, I talked to the director last week, I think they have about 5 providers there, plus the nursing staff and so forth like that. They've got a lot of services there that the other clinic did not have. And from hearing to physical therapy, they've got a women's clinic. They've got a women's clinic there, which is very important for women veterans with a separate entrance and so forth, because that has been turned to be a problem. And they recognize that. And so they've got a women's clinic. They have cardiology come in monthly, pulmonology come in monthly. They're working on building out their optometry clinic. So it's got a lot of services out there for you. So we're here to help provide you information about those kind of things and direct you to where maybe the services that you may need. The Veteran Service Office actually has been around, believe it or not, since 1937. And it wasn't very well known. It still isn't, which is surprising to me, but I'll take that back. I shouldn't be surprised, because when I was the commanding officer of Naval Base Ventura County, so I was the lead Navy in the county, I did not know this office existed. It's a surprise, it's surprising. So part of my job when I took in charge of this is get the word out. Get the word out, and with your help, keep spreading the word that this Veteran Service Office is there to help veterans get their benefits. We are not part of the VA. I'm a county employee, but we are work very closely with the VA, and we'll also work very closely with CalVet. CalVet is the California's Veterans Department of Veterans Affairs. Wonderful department, and I don't know if you've been to other states, but this one has great services, and I'll talk a little bit about some of the things that they provide also. But we are county employees. People get confused. They think that we're the VA, which is fine. I'll let them think that sometimes. I'll correct them. But some folks have some bad taste in their mouth from working with the VA, and that's years ago. Things have gotten better. The VA has really turned around and is really getting better. They are spring-loaded to try to say yes, than try to find a way to say no. Okay, they really have a duty to assist the veterans and help you get the benefits that you deserve. So let me just start off with a quick little VA 101. It's organized, well, obviously in 1989 is when it became a cabinet-level agency, but it's organized in 3 sub-agencies. There is the Veterans Health Care Administration. Of course, as it sounds, they run the hospitals, the clinics. It's one of the world's largest healthcare organizations. They see over 100,000 patients a day throughout the whole network, which is amazing. A lot of them are, the hospitals, a lot of them are connected to medical schools, or associated with those. We've got, there are 60 outpatient clinics, and I talked about the new one here in Ventura County. Vet centers are also, those are for mental health treatment for combat veterans, and those are throughout the state and the nation. There's a vet center here in Ventura that is for your use. And then a CalVet run system is the veterans homes. There's 10 of those veterans homes in the state, one of them here in Ventura, and they're resident assisted living facilities. And some of them have different levels of service, and you have to apply to them. And there is a cost, and it's about, at least for the one here in Ventura, it is 55% of your income. But that provides, that's your living, your food, and everything like that at this veterans home. It's a pretty nice facility. So that's run by the Veterans Health Care Administration. The next one that a lot of people aren't running to get to is the National Cemetery Administration. That, as it says, runs the national cemeteries throughout the nation, except Arlington. Arlington is run by the Department of Defense, particularly the Army has jurisdiction over that. And in California, there are 5 national cemeteries that are accepting interments right now. We've got Riverside, Sacramento, Bakersfield, Miramar, and San Joaquin. There are also some state veterans cemeteries that are available, and they're looking to building a new one in Southern California for that. Then the third leg of the stool is the Veterans Benefit Administration. This is our world. This is where we work mostly, and that is they handle the disability and compensation claims, VA home loans, VA pension, your VA life insurance, burial allowances, and vocational rehab facilities, just to name a few. Veterans Benefit Administration. That's the one that is the pretty big, and that's who deals mostly with what we deal with. Okay, and like sometimes a disjointed family, the three pillars sometimes don't talk to each other. So we can try to help bridge that gap too, because when you sometimes the health care may not talk to the benefits, and vice versa. But that's our job to really help bridge that gap. So some of the benefits that CalVet provides. Okay, I talked about the veteran homes. Another one that is a real big benefit that we get a lot of traffic on. It's the college tuition fee waiver. That is such a wonderful benefit. Let me go over it for you. This is for a veteran who is any percent service connected, meaning any percent disabled, determined by the VA. And believe it or not, 0% is a service connected disability. You have to file to get 0%. You don't walk in the door and you're 0%. So you actually have to file to get 0%. So 0 to 100%. If you're a service connected veteran, your dependents go to a UC, CSU, or community college tuition free. A wonderful program. There's no limit on it's only for undergrad, it could be for your doctorate. It's a really great program. There are 4 different plans to it. In the handout I have here, it gives you some details on it. The plans we mostly deal with are Plan A and B. Plan A is for pretty much 100% service connected veteran, and there's no income requirement on Plan A. The only issue with that is that if you're using Plan A, the student cannot utilize their what's called Chapter 35 benefits. Those are the VA educational benefits. You can't use those and use the college tuition fee waiver, Plan A. But the other one is Plan B. That's for any service-connected person. That does have an income limit, and that's the student's income. The student's income and the parent support. This year, that cannot be over $15,225. The only information, I'm going to read between the lines on this, the only information we gather to determine that is the student's tax return, or if they didn't file any taxes, a letter of non-filing from the Franchise Tax Board or the IRS. Okay? And then if they're under that, and that the things we look at, and these applications come to our office. We're the ones that approve those things. And we're the veteran service connected, they're under the income, they're related to the student, whether, it could be adopted, could be step, biological. They've, those 3 things, and then we approve the process. It's a great program. It's a wonderful program. And we get a lot of them. There's a season for it. Just before the fall semester starts is when our season starts for those things, and then it trickles off, and then it gets back up again around the December timeframe, getting ready for the spring semester. Every year they have to apply. There is no money exchange in this program, though. It's not like CalVet is paying the school the cost of the tuition. It is, as it says, it's a college tuition fee waiver. The university is waiving. This is only for state schools, obviously UCs, CSUs, and community colleges. The veteran does not have to have exited or entered the service in California. The only requirement is that the student is a state resident according to what the school determines. We don't make that determination. And some people get confused. They forget that USC is a private school. So we get those things, and sorry, it doesn't apply to that. That's one of our biggest. The other one of the CalVet is they do home loans. CalVet does home loans, which you could utilize your VA benefit and the CalVet home loan, and they're very competitive and very personal in the sense of the customer service. You know how when you get a VA home loan, you're actually going to some mortgage company and getting a loan, and it's VA's guaranteeing that loan. But you still got to go through the mortgage company, they still got to do the underwriting, everything like that. You go to CalVet, it's CalVet who's funding the loan. They're the ones that are underwriting it. And what is great with this is sometimes they look at, maybe someone's got some bad credit history over time, and their number may be low. But the CalVet may look at it and say, hey, over the past year, this person has been paying their bills on time and everything. Yeah, we'll lend them the money. And they're very, very personal. They never sell the loan. They service the loan for the life of the loan. What's interesting also as part of this loan is that earthquake insurance is included, which can be pricey. So it's included in the loan there. So that's a few examples of the CalVet benefits. So I kind of alluded to this, but service connection, that's what a lot of folks come to us for, is try to get a service-connected disability because that garners disability payment, tax-free payment from the government. So how does that happen? Well, to be eligible, first you have to be a veteran, obviously. Secondly, your discharge has to be under conditions other than dishonorable. Kind of a backwards way of saying it, but honorable, general under honorable conditions. If someone has an other than honorable discharge, well, we can certainly put together the claim and put it there, send it in. The VA will look at that and look at the scope of the person's service, and they'll look to determine, okay, maybe we consider his or her service honorable for VA purposes. It won't change the DD-214, the discharge piece of paper, but for the VA purposes, they could consider it honorable. Or they may come back and say, no, it's considered dishonorable. But, so that's one of the requirements, conditions other than dishonorable. And then you're looking for conditions. What happened in service? When people come to our office, we want them to come hopefully with a list of what they want to claim. And the VA is looking for 3 things to get something service connected. They want it to be a current disability. So when I say current disability, have you seen a doctor within the past year about it? Okay. Second thing is, what happened in service? Was there an accident, an illness? Was it the nature of your job? I was in aviation. Noises, loud noises, hearing loss. That's the nature of your job. So I don't have to pick one particular flight or anything. That's the nature of your job. I talked with like some Seabees jumping up and off and on heavy equipment, maybe messing up their knees. Nature of their job. So they're looking for that. Or is it a specific accident that happened? Illness. And the thing is, this doesn't have to have happened when you were actually at work. Because when you're in the military, it's 24/7. And that's why when you take leave on Christmas Day counts as a day of leave. Unlike in the civilian world, that doesn't count on your vacation. But it's 20, so you could be out playing basketball with your buddies, had been there, and you broke your ankle. And that broken ankle could be claimed. Doesn't have to be when you were at work, because you were still on duty. Just as long as there's no willful misconduct. Okay? And I'll give you an extreme example of willful misconduct. Is someone wraps themselves around a telephone pole drunk driving. Okay? The disabilities caused from that accident may not, I won't say will, may not be covered by the VA because there was probably some willful misconduct in there with a drunk driving piece. However, on the other hand, if you were driving along on a Sunday going somewhere, and unfortunately, boom, get into an accident, and you develop disabilities from that, and you were on active duty at that time, those disabilities, you can claim those disabilities on a VA claim, and may get a disability percentage out of that. That's considered a service connection kind of thing. So, current disability, something that happened in service, and the third one is, we call it the nexus, the way the VA puts it all together. 4 different ways they can do that. One is a direct service connection. That is, you had an accident, hearing because of aviation, your job, you had an illness, something like that. That's a direct service connection. The second one is called secondary service connection. So if I give my example, let's say the ankle again, where it broke and maybe it didn't heal well, and you claim that's now service connected. Because of that, you were limping around a lot, and now your hip hurts. Well, you can claim the hip secondary to your ankle. That's called a secondary service connection. There are a lot of other conditions that can cause secondary, if they're service connected, could cause a secondary condition. Diabetes has a lot of other secondary conditions, and if you're service connected for diabetes, you can also claim those other service secondary conditions caused by that. That's a secondary. Third one is aggravation, and this is if you entered the service with a condition. Hopefully it's in their entry physical, so it's noted there. And then during their time in service, it got worse. The fourth one, which applies to, can apply to a lot of folks, it's called a presumptive condition. So these are conditions that if you were in a certain area, and I'm being very general in this one, and I'll get more specific in a second, in a certain area during this certain time frame, and you have the condition, it is presumptive to be service connected. You don't have to show, it was an accident. I have to show it was an illness, whatever. For example, Vietnam vets. Vietnam vets here? What's the big thing about Vietnam vets? Agent Orange. The big herbicide that was used there caused a lot of issues, has caused issues. There are a list of presumptive conditions as a result of Agent Orange. Now, you're not claiming Agent Orange, you're claiming the condition. So if you've had that condition and there's evidence you were in Vietnam, or now, because of the PACT Act, who's heard of the PACT Act? That's a new act, and I'll go into a little more detail on that in a second. They've expanded that because Vietnam used Agent Orange, Thailand used Agent Orange, Guam used Agent Orange, so they've expanded the countries. But if you have the condition, you have proof that you were one day in that area. I had a veteran who was a Vietnam vet, aviator, naval aviator, and he had 2 landings that happened to be in Camarillo Bay. It was on his logbook, and boom, he got presumptive condition for those things. So you show you were there, boom, have that condition, it's presumed service connected. Now we just rate that condition, from 0 to 100%, how bad it is. We don't, the VA does it. So that is the generalities of what the VA is looking for when you're claiming something. But we're here to help you with that. We're here to help in the sense of, you come to us and we'll talk to you, what do you want to claim? Okay, great. Do you have medical records for that? When's the last time you saw a doctor for it? If it's been, I haven't seen a doctor for 2 or 3 years, well, hey, let's make a doctor's appointment. And why don't you make a doctor's appointment and see, and then come back once we have those medical records. Because we're going to need medical records to submit with the claim, okay? You're going to need to show that you've been seeing a doctor because they want to see it's a current disability, okay? But if you make an appointment with us and we don't have everything together, that's fine. Because what we can do is we can submit what's called an intent to file form. This is a form that we submit to the VA saying, hey, Joe Veteran's going to file a disability claim. And when they get that, which is the same day that we send it, that preserves that date that they receive it as the effective date of the claim. You have a year from that date to file the claim. So it gives you time to make appointments, gather the necessary information we need, and then to file the claim. And when it gets adjudicated, it'll go back to the effective date. And then there'll be some retro money that you'll get for those months and so forth like that, if assuming you got awarded something, okay?
Question.
Yes, sir.
Now, just make a statement that you don't get anything until you file.
Right.
From that day back, you don't get anything.
Yeah, it depends on if we're talking now. If I go back to the PACT Act, okay, so here's the thing. I'll jump to the PACT Act. But in general, you're right. The day you file or the day you submit your intent to file, that's what the effective date is, okay? Let me talk about the PACT Act while I'm on that. This was an act that got signed in August of 2022. Great act. And really what it did was it helped increase the number of countries for Agent Orange, for the Vietnam vets. It included hypertension now as an Agent Orange presumptive. And it also added, for the burn pits, a toxic exposure for our Gulf War veterans and the different countries and areas and the different conditions. And they say there were 20 presumptives for the toxic exposure. It's really more than that because they're so general in the presumptive. They say head cancer. Well, there's many different kinds of head cancer, lung cancer, things like that. So in generality, but it's pretty expansive. So, for example, in the hypertension, we're seeing a lot now Vietnam vets coming back to us to file a hypertension claim, and if it was previously denied, that's good. That we file the claim, it can go back to a year from when we filed the claim or the intent to file because of what this PACT Act is called a liberalizing law. So it used to be before August 9th of this year, 2023, actually went to August 14th of 2023, the effective date was going to go all the way back to August 10th of 2022 because that's when the law was signed, right? You can't get compensation for something before a law was signed. So it goes back to the law date. And then you may have heard a whole rush of people, I got to file my PACT Act claim before August 9th. Well, okay, but now you can still file it. And if you have evidence that you had that condition on August 10th of 2022, you will get a year back from that effective date. So that's why it's not always the year back to your effective date. It's kind of complicated. That's what we're here to help you out with. But there's opportunities to get retro payment on those. And you do get retro payment anyway when you file a claim, and it takes 3 months, 5 months, 6 months to get adjudicated. You'll get those 5-6 months of money back in a lump sum amount. Had one of my claims officers helped a veteran, it was last month, and he received $135,000 in retro payment, plus then started, and it all dealt with the effective date and what he had and so forth like that. But yes. Then the thing with hypertension also is what we're seeing a lot for veterans, Vietnam vets, is the numbers are so high that we're seeing a lot of them getting 0%, which is fine. Again, yeah, okay, 0% is not compensatable, but what it is, it's a service connection. Hypertension, unfortunately, causes other things. So if you're service connected for your hypertension, and then now you've got something else that is as a result of hypertension, we can claim that secondary to the hypertension. So we're seeing a lot of 0% because, and let me give you, I got this, and all these decisions are in law. It's all a big book with little font that decides how it's decided. But for hypertension, for example, to get just 10%. So if I didn't explain it, I said service connections are from 0 to 100% in 10% increments. So for hypertension, just to get 10%, your diastolic pressure, the lower number, predominantly, that's the key word, predominantly has to be 100 or more. And your systolic pressure, predominantly, the upper number, has to be 160 or more. So, and then to get higher percentages, those numbers kind of go up. A lot of folks we're seeing with hypertension is that one, it's treated, one, they're on medicine, so they've got it under control, but they don't have that predominantly amount over those numbers. There are some that do, so they get the higher percentages. But that's what we're seeing a lot of. But it's not to deter anyone from filing for hypertension, particularly for the Agent Orange or Vietnam vets. Some other presumptives, we talked about Agent Orange. Who is not, you can't turn on a TV without seeing a Camp Lejeune ad, right? You see those all over the place. There's two different things to think about that. The VA has always, for a long time, I should say always, for a long time has had Camp Lejeune presumptives. Okay? That, of course, is for the veteran. They're in Camp Lejeune at a certain time, they got this condition, boom, bing, bang, it's presumptive and that. What you're seeing now is as a result of the PACT Act, and it was really one page out of the act, the Camp Lejeune portion of it. This is really a tort action. It's an ability, it enables the civilians who were living on the base, government workers, the family members who were there, to theoretically, basically, you're suing the government for these conditions that you have. The veteran can do it too. You can do it too. Things to be careful about with this is, one, no one really knows how this is going to work. Okay, really how it's going to be adjudicated, how it's going to be, what's the money going to be and all that. Secondly, is if you have those conditions and you went to the VA and you got claimed it from Camp Lejeune, you got your thing, and you're already getting paid for it, you can still file the claim. File the Camp Lejeune tort, if you will, sue. Whatever the award is, they will remove what they've already paid you, theoretically. Whatever the government, and this is how they don't know how it's going to happen either. I'm going to do some simple math. So let's say the award was $1,000. VA's already paid you $500 for the claim. You're only going to get $500 from the suit. The other thing to be careful about is, so you've worked with this law company, right, to get this all going. They got to take their cut. Their cut, their percentage is off of the total award, not what you get. So they're getting paid off of that, in my example, that $1,000. And, well, you're really only getting $500. You're not getting $500 anymore, kind of thing. It's just, I'm not discouraging anyone, again, from doing it. It's just you got to be careful. Think about how it's going to work with, you got to be careful on that. That's all out of our world. We don't deal with it. Like I said, that's a legal thing. It's not a VA thing. So just to be aware of that. You see all those commercials out there and they guarantee, hey, come see us. We'll get you all this. Just step back, take a deep breath, and maybe consult with someone first. So Camp Lejeune, talked about Persian Gulf. Another interesting one that I didn't really know until I got this position, a presumptive condition, if you served 90 days in the military, and unfortunately then you develop ALS, that's a presumptive condition for service. Yes. Just have to serve 90 days. Don't ask me why. I just know that's what. So if you get to ALS, and those ALS claims get settled fast. Because unfortunately, ALS is very debilitating. And if we filed an ALS claim on Monday, the odds are on Friday it's already decided on. And that goes at 100%. I guarantee you file ALS, it's going to be 100% service connected. So that's an interesting, keep that in mind too. Hopefully it doesn't affect anyone, but just keep in mind that it's there. And also some of these presumptives that we have for the, as you know, Agent Orange or the Gulf War stuff, they happen later in life or they take time in life to develop. So just always keep in mind if you get something, is that as a result of this? That's when it's time to make an appointment, give us a call. Hopefully you've seen a doctor about it or anything, and we can talk about it. Okay? Let's see. So once the claim is submitted, we put all the issues on there that we want to file for. Then it gets submitted to the VA, and then it goes through the VA process. They will schedule you for what's called C&P exams. These are comp and pen exams. These are exams that usually it's a contracted, bless you, VA contracted doctor that will examine you for whatever this condition is. And you may go to one exam and may take care of a couple of these conditions. And what they're doing is they're looking for further evidence to determine, well, was it more likely than not that this did happen in service? Obviously, a presumptive is a different beast on that. How bad is it? And because there's things like if you have back problem, thoracic back problem or something, one of the things they look for is your forward flexion. Is it over 30, less than 30, less than 20? Because all that matters in how it's decided on. Example of that. So you go through these C&P exams to do these things. They fill out a questionnaire and submit that, or a report, submit that to the VA. VA uses that as additional evidence to determine how each one of your conditions is going to get rated from 0 to 100%.
What if your doctor doesn't agree with what this doctor says?
Well, we can certainly submit that information, but you won't know what that doctor says until the claim is decided. You will really not know what that doctor says. You'll know that the claim may have been denied. You will not have access to those records. You will know why it got denied. You'll know if it got denied because, hey, it was not service-connected, or it got denied because it was not a current disability, it was not a diagnosed disability, or let's say you got, it was 10%. You got 10% because of X, Y, and Z. To get, and it'll tell you on the narrative, to get 30%, you need to have this, this, and this. Yes, yes, yeah, yeah. So, but that's an after the fact, we decide, you know, we don't like that decision or whatever, we can go for something else. Yes, sir.
My knees, hips, and back come and go. What if I go in it? It's a good day.
I know, yeah, that's always a, pretend it's not a bad day. You know, I don't know. No, I don't know. It's that's hit or miss. It is, really. But we also have, that's not the single decider. You've also got your medical evidence. You've been seeing a doctor for a while for it. I'm hoping. But we got that evidence to show, look, over time, he has had this issue. And it's been like this. Then we go, what we'll do, you go through, see what the decision is, and then we come back and reattack if need be. And if we continually reattack, you're not losing your effective date, okay? Particularly if we submit an appeal within a year of the decision, and then that takes time to decide it, and it finally decides in your favor, that claim will go back to the effective date of whatever that initial claim was. You just have to show a continual of fighting it. But the thing is, then we also got to determine, is that service connected? So that's another piece of it. Go through those CMP exams. There may be a bunch of them. There may be a few, depending on how many conditions we've claimed. The VA gets that information along with your medical record, along with your service record they look at. Any other statements? If you've got friends or spouse or something who wants to write a statement in support of your claim, that can be done. The biggest thing on we call it buddy statements or spouse statement is don't diagnose in those statements, because you're not credible to do that. You can't say, yes, he has sleep apnea. No. What you do is you say, he wakes up gasping for breath, or say how it affects his life, things like that. Don't diagnose. Oh, he must have PTSD. No, you're not qualified to do that. How does it affect? Those are keys of when you have a statement that you're going to submit with the claim. So then the claim gets rated. Each individual issue that you claimed gets rated. And as I said, it could come back as not service connected. Well, let me step back. It's come back as not a current condition, or it could come current condition, not service connected, or service connected, current condition, and that's the thing they rate. Okay? From 0 to 100, each one. Boom, 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 boom. It's not additive. It's not if you get a 20% on your condition, a 30% on a condition, and now a 30% on the condition. That's not going to be 80% service connected overall. It goes through what I call VA math. VA math, it all deals with the percentage of person after we look at the highest rating. It's too complicated. It's a fair system. It is. Things that are additive, 3 10% or a 30%, a 20% and a 10% do add up to 30%. Anything beyond that, it goes through the VA math. The closer you get to 100%, the harder it is to get 100%. Not because they're trying to prevent sending the money out, it's just how it works in the percentage of the person. If you are at 80%, you don't just need a 20% on a service on another issue to get you to 80. That 20% probably, I'm going to get you to 100. That 20% probably won't move your 80. You'll need something higher than that. It's just how it works. Because now we're looking at, okay, 80% of the person is already service connected. I've got 20% left of this person. How much is 100% of that 20% affected? I'm being very general in this. But that's how they work out their math. If you got questions when you get your results, We can go through each one and show you how that worked out. But long story short, you come out with one number at the end, your service connected from 0 to 100%. 10% is when you start getting paid. If you get 30% or greater and you have a spouse, you get additional money for dependents, spouse or kids, minor kids. If you get to 100%, there are a few other things available. There's usually a possibly CHAMP VA, which is a health care for a spouse. Because remember, VA health care is just for the veteran, not for the dependents. There's also the Chapter 35 benefit, which is the education benefit I talked about earlier. That is usually kicked in with 100% service connection. And then there are things that can go on top of your benefits. If someone is at 70%, but because of their conditions they're unable to work, you submit a claim for individual unemployability. That's another little bonus that you can get. If you get awarded individual employability, even though you're 70%, you get paid at the 100% rate. So same with like 80 IU, 90 IU, things like that. Aid and attendance. Heard of aid and attendance. This is if you've got a condition that you're pretty much 100% for, and you need the assistance for the 7 activities of daily living, dressing, bathing, or usually if you're in a nursing home type of thing, that is there. We apply for aid and attendance. That is additional money on top of that 100% payment. It varies, so I can't give you the specific amount. It varies based on, do you have a spouse or anything like that. That requires a whole nother process. You can't just file a claim for aid and attendance. That's like the cherry on top of the sundae. You got to have the sundae first, which is your service connection. Okay. Then the monthly checks are direct deposited. If you have a retro payment, that's a lump sum that gets put into your bank shortly after the decision. You will get a letter from the VA saying, here's what we decided. If you're working with us, we can see those letters probably before you get them. We see them when they get submitted in. We give the VA a little one potato, two potato to try to get it out before we might give you a call and say, hey, this is what's decided. But if you have a claim and it's decided, you can probably check your bank account if it's, suddenly see this amount come into your bank account. That's probably what that is too. So you get a letter, it'll tell you what they decided, and it'll have a narrative in the back of it, which tells each condition that you filed for, why it was denied, why it was approved, and what you need for the next highest level if needed. We'll go through each one. Sometimes things get deferred. We'll decide on all these issues, but we're going to defer a couple of them because they need more information. Maybe they need another exam. Maybe they need some more medical information, things like that. Now, that'll keep going through the process. Again, we'll help you navigate through that stuff. So the things when we submit a claim, it's going to be the claim form, hopefully some medical records. We need that evidence. If the VA doesn't have your DD-214 yet, we'll need that. And you don't really have to have your service treatment records, meaning your medical records from when you're in service. The VA will go grab those. If you are getting treated at a VA hospital clinic for your conditions, we don't need those records because the VA can go grab those kind of things too. Okay. But personal private records, it's best if you get them and bring them to us to submit. The VA can go ask them after you fill out a form requesting them to do it, but they will only go twice to the doctor. Do you have your records? We were looking for, Veteran Sue's records. You get ignored. They'll try again. If they don't get anything 2 times, they give up and they tell hey, I tried to go to talk to Dr. Smith's office, but no reply. It's best for you to go get them. So, because we want to submit a fully developed claim. That means a claim that has all the evidence with it. And that goes through a little faster process. If it's a standard claim, that means it needs some more work, it needs some more development. The VA may send you a letter saying, hey, we received your claim, but we need this, this, and this. And then they'll give you, hey, please respond within 30 days. When you get those kind of letters, again, if you've worked with us, let us know. We can see the letters. It's not like we get notified when you get the letter. So we can help you go through that process also. And we give you quick examples of just the past year in 2022, what we did in our office. We filed over 2,151 benefit claims, and that garnered over $5.5 million in retro payment for veterans, and over $720,000 monthly payments for veterans. We also processed over 650 college tuition fee waivers, and that saved veterans over $3.2 million in tuition. So on average, we see in our office between 450 and 500 veterans a month. So we can be in person, we can do it over the phone. Either way, it works out for us. Other survivor benefits. Dependency indemnity compensation. That is provided to a spouse of a veteran who A, died of a service-connected condition, or B, was 100% service-connected at his death, or his or her death. Okay. So to show that he died of a service-connected condition, we've got to make sure that is listed on the death certificate somewhere. They do have cause of death, and then they also have a list of contributing conditions to death. It's somewhere on there that helps. For example, diabetes. If you've had diabetes, hopefully that's listed on there. Ischemic heart disease, another Agent Orange issue. Coronary artery disease, things like that. Hopefully that's listed on there, because then we file that claim. Then that is roughly $1,400 something a month, tax-free to the surviving spouse. That's DIC. Something, again, we can come file those in. There's VA pension. This is for a veteran who does not have any service connection. But VA pension is a needs-based program, meaning income-based. You have to be pretty low on the income scale to qualify for this. You have to have a net worth that is at or below $150,538. And your income, the family income, not just you, but the spouse's income, has to be below this certain amount. It has to, like it's pretty low, like $20,000 a year kind of thing. Varies. It's between $15,000 and $20,000. But if your income's over that, but you have a lot of non-reimbursed medical expenses, which we see a lot of folks qualify this as if they're in a home, and the cost they're paying for the home, and they're not getting reimbursed, meaning it's not insurance paying for it, and they're paying for it out of thing. That can be deducted from your income and bring that number down to where maybe you then are eligible for the pension. The thing to be careful about, though, I had a veteran who qualified for pension when he was 55, just based on his income and everything. And he was getting it, and then in 2018, his spouse suddenly qualified for Social Security. That, unbeknownst to him, put him ineligible for pension because that income was now included, put him over the income amount, and has caused a significant debt. So that's just to be careful of on pension. Also, surviving spouse pension, the same sort of thing. If you're a surviving spouse of a vet who was not service connected, I'm not talking DIC, I'm talking surviving spouse, your spouse passed away, was a veteran, and you meet these same income requirements. Plus, there's a few things that the veteran, they have to have served during at least 1 year during a wartime, 1 day during a wartime period. Not they have to have been in combat, they just have been served during a wartime period. And have to have honorable discharge, things like that. But that's the surviving spouse could get the pension also. Again, the same kind of income requirements. You can put aid and attendance on top of pension, too, if that's needed. So that would be additional money on that. Same with DIC. You can put aid and attendance on top of DIC. Burial benefits. If the veteran passed away because of a service-connected condition, that's $2,000 for a burial benefit. If it's not a service-connected death, the veteran can get up to the family can get up to $948. It depends on the time of when they passed. If they passed after October of 2023, it's $948. You have 2 years from death to file those claims. If usually if it's a service-connected death, the spouse does not usually have to file for the burial benefit. The VA recognizes that and automatically sends that. VA healthcare. I encourage every vet to enroll in VA healthcare. Doesn't cost a dime, free. Even if someone had a great job, even if I tell them sign up for it, it's a great spare tire to have. And there are things that I'm retired Navy, so I get TRICARE as my health and all that. Well, there's certain things TRICARE doesn't cover that VA healthcare does. Simple thing as chiropractic. Chiropractic's not covered under TRICARE. It's covered under VA healthcare, so you can use that. You can use that. For those who didn't retire, one of the great things about if you enroll in VA healthcare and you're service connected, you get this little VHIC, which is a VA health identification card. So a card, got your mugshot on there and everything, and underneath it says service connected. It says healthcare eligible, service connected. You can take that card, go back on the base, go to the commissary exchange, go play golf, go to MWR, all those kinds of things. You just have to go to the Pass an ID one time. They do a quick 30-minute background check, and then you're good for 2 years on Naval Base Ventura County. If you want to go to another base, you have to go through that same process on that base. So for our young veterans who got out, this is a great thing. Gets them back in there, so buy gas on there and everything like that. So that's a good benefit also. VA does offer life insurance. That's a pretty competitive. It does cost. There's a premium. It's not a free life insurance. There's no waiver of the premium anymore. If you're 80 and below with a service connection, you're pretty much automatically accepted into it. It's up to $40,000 in $10,000 increments. For the first 2 years, however, you pay into it and there's no benefit. This is how they're getting away from, there's no medical requirement either. For the first 2 years, you're paying your premiums, but if you pass away during those first 2 years, your premiums with interest will go back to your estate. So, but after the 2 years, you got the whatever you're paying for, $40,000, $30,000, whatever. So in summary, really, there's a lot of benefits out there, a lot of things that are available to veterans that if you got any questions, I've got many of these books up here called the Veterans Resource Book. This is provided by CalVet. This one talks about federal benefits and state benefits. I got those here for you. I got a few of these federal benefit books. These are just talking about the federal benefits. A lot of stuff I talked about already. Yes, ma'am.
Jim, first of all, thank you for your service.
Thank you.
And all the service people in the room. I'm going to ask a civilian question.
Okay.
Since I don't follow your lingo here. My brother during Vietnam era served in the Air National Guard.
Okay.
Is he considered a veteran, a full veteran, for the various benefits that you're talking about?
Was he in Vietnam? Did he actually go to Vietnam?
No.
Well, if he was ever under Title 10 orders, so if he was ever federalized, okay? So you know what the thing to ask? Is he still?
Yeah, he's still with us. Thank you.
I'd ask him, does he have a DD-214?
Do that again.
DD-214. DD, Delta.
Delta
214. That is the separation. That's the separation paper.
Right.
If he was under any kind of federal orders as a reservist, then when he's done with those orders, he gets a DD-214.
Okay.
Then he's eligible. Then that makes him eligible for a lot of the federal VA benefits.
Is it very specific in terms of it's not blanket? Yes, you are a veteran and you qualify for all of this, or is it very specific?
No, the biggest thing is you gotta have not an dishonorable discharge. Yeah.
But
So the thing is that also then if he's claiming a condition, we gotta help show that condition happened during those times or when he was going for, if he was doing any kind of reserve weekend kind of stuff and all that kind of thing. That all falls into it.
And I'm assuming, he lives in Texas, I'm assuming every state has the equivalent of a CalVet?
They do at different levels, different sizes and all that, and different requirements. For example, Texas, They have a tuition kind of program too, but you have to have entered the service in that state or exited the service in that state. So, but I mean, but they do have at different levels. Not many states have a book this size though, that talks about the benefits. So, I've got those books. I've got a flyer here. You're welcome to pick up. It talks generally about our office. It's got a flyer about the field offices we have, and also about the college tuition fee waiver, and the card here to call to make an appointment. We are mostly a by appointment kind of thing. The one other thing I forgot to mention, getting veteran designation on your driver's license. You can do that. You come to our office, we fill out a form called a VSD. You take that to the DMV when you renew your driver's license, and bing, bang, boom, you get the veteran on your driver's license. It doesn't cost anymore. Used to be $5. Now it doesn't cost anymore. Okay? So, excuse me?
What about a spouse?
Is she a veteran?
No.
Then she doesn't get it.
She should be.
I know. So anyway, any other questions? We're running out of time here, but I'll be glad to stick around if you got any questions. Yes, sir. I'm sorry.
Is your office in Camarillo?
Well, I've got a field office in Camarillo once a week, but my main office is in Oxnard near the collection. I got the address on the cards up here. Oh, they may be saying how much you have left of your VA loan eligibility.
Yes.
Yes, because that has, you can have more than one VA loan if you haven't used all of your entitlement for that.
Okay.
Yeah, of what they guarantee.
Yeah.
It's pretty high these days.
Yeah.
It's over $1 million in this county.
Is there a way to find out the date of when someone enlisted? I can only find my husband's discharge.
It would be on his DD-214. That's when it would be, unless you got some other paperwork. But the DD-214 has when they enlisted, when they got out, the character of service, honorable, dishonorable, other than honorable, on there, and it has awards, helps with locations where they were. You can fill out a form that's at the archives. We can help fill out a form called an SF-180. We send that into the National Archives, and they will find it. They will pull it if it's there. Hopefully it is. It's not a fast process, though. It may take a couple months. They have recovered from their COVID backlog, where there are millions and millions of requests behind. They have recovered from that. So it does take some time, but that's how we could do it. I'll stick around for other questions if you need to. Thank you all for being here. Appreciate it.